Hi, my name is Jenn Matucha, and I'm an embryologist at Ovation Fertility in Carmel, Indiana. I recently had an abstract accepted at the ESHRE annual meeting, and the poster I submitted was based on some quality control data that we performed in our lab to assist our physicians. So we have many patients that go through IVF and they select PGTA to genetically screen their embryos. And although they have euploid embryos for transfer, we wanted to help assist our physicians be able to pick the best embryo for transfer and maximize each cycle. So we analyzed all our single euploid embryo transfers between 2020 and 2022, specifically looking at patient age, day of vitrification, day 5 or 6, as well as the embryo's morphological grade. We had subjectively graded the inner cell mass and trophectoderms as either good or fair in these transfers, and we resulted in 3 different embryo categories. With the inner cell mass graded first, we had good, good, fair, and fair, fair. So we saw that with all 3 of these embryo grade categories, we had significantly higher rates of positive chemical pregnancy, clinical uterine gestation, and fetal cardiac activity from embryos frozen on day 5 versus day 6. We also found different significant factors when evaluating these grades by age group. So for example, in our youngest age group, patients less than 34, each grade was significantly different from each other, with good embryos having better outcomes than the other 2. And in patients 34 and 37, clinical outcomes from good, and fair, embryos became similar, but both were significantly higher than fair embryos. And we saw this similar outcome in patients 30 and older, but with the only difference was that fetal cardiac activity was significant only between good, and fair, embryos. So, although every euploid embryo has capacity to implant, we were able to use this data to further validate a ranking system in our lab for our physicians to help maximize each patient's transfer cycle. We found that the day of vitrification, embryo quality, and patient's age do make a difference. Thank you.